Hi, it's Patricia Coughlin continuing to talk to you about this topic of rupture and repair. Did you know that the single most common cause of ruptures and breakdowns that don't get repaired is the therapist's tenacity in sticking to their interventions and their model, even when the patient is having a negative response? Let's really talk about this. This is very, very important. As I mentioned the last time, research suggests that therapists are quite attuned to misalliances and misattunements, and yet, unfortunately, they tend to attribute the trouble to the patient, and they're not looking at their contribution. Therefore, they are also not changing what they're doing in such a way to rescue, right, the breakdown from an utter failure and catastrophe. So again, the research is clear. Therapists who stick to their method, right, stick to their therapeutic guns, regardless of how the patient is responding, are going to get poor results. So it is extremely important that instead of just tracking how you're doing with your method, you're actually tracking the patient's response to intervention. This is your most important data. I'm thinking of a patient who I treated, and of course I use ISTDP as my model, but certainly attempt to be, my goal is to be flexible in implementing this technique based on the needs and capacities of each person. But those needs also change over time. And this was a really interesting case in which the patient had responded extraordinarily well to this method the first 6 hours or so. And then it seemed rather suddenly to me, she started overtly resisting the very method we had been using, which had clearly helped her. At first, I saw this as resistance on her part and treated it as such. But she continued to dig in her heels and say, I don't want to do this anymore. I don't want to have to look at my angry feelings towards you every time I come in here. I don't see how this is going to help me. She said, even though obviously it has. But so she was like contradicting herself, going back and forth. I was really quite confused. But I remained open and curious. And I dropped my agenda and just started to ask her, tell me, what, because you're saying this was helpful to you, but you also seem to be saying it's of limited value for us to continue in the same way we have been going. So here's a case in which over time her needs were changing. And I think it was both an issue of focus and emphasis that had to shift, but also, as we were talking about the last time, really entering a negotiation where we could decide together on the course that the therapy was taking. This was a woman who had been extraordinarily compliant throughout her life. And so the fact that she was able to kind of say no to me, no, I don't want to do this anymore, even though it was, not very elegant and so on, I was looking at what is trying to be expressed here, right? This isn't just resistance. Something new is trying to emerge. And in fact, in recognizing that, and then in putting the steering wheel over on her side, to ask her what did she think would be helpful at this point, it really turned the whole treatment around. So it was a great example of rescuing a failing session in such a way that actually promoted deep change, that increased trust, and that promoted resilience. So really take this in. If things are going south, it probably has a good deal to do with you. And it's very possible that you redoubling your efforts, which I often see happen, right? It's not working, so you keep doing it more, right? You redouble actually using the very techniques that the patient is responding poorly to. Just drop it and begin to inquire with the patient about not only their experience around what's been happening, but what they feel is important and what is going to be helpful for them going forward. Right? Again, this is also going to solidify that collaborative alliance and really help you turn the ship around. So I hope this is helpful, and I'll talk to you next time.